I'm Christina Bausch. I'm a women's health physical therapist here at Rebound Physical Therapy in Topeka, Kansas. And so today I wanted to talk to you a little bit about osteoporosis and what we can do to decrease our risk of osteoporosis. So first, let's just talk a little bit about our bones. So our bones are actually living tissues. So they're constantly being rebuilt and constantly being broken down. So when we're young, our bone growth is happening faster. So we're growing more new bone faster than it's breaking down. But as we age, that bone growth begins to slow down. So by the time we're about 30, we are actually kind of at our peak bone mass. So past that point, we're actually breaking down bone faster than we are rebuilding it. So it's important when we're young to, be active and try to build up as much bone mass as we can, because from there we're just kind of have what's in the bank and we're just kind of depositing out from that. So what osteoporosis is it's thinning of our bones. So they become more porous and more brittle and more at risk of fracture. There's different stages of osteoporosis. So you may have heard the term osteopenia. So that basically means that it's not severe enough to be osteoporosis, but that bone is thinning and it's at risk. So that definitely is a good time to do as much as we can to prevent further progression to osteoporosis. So some of the symptoms of osteoporosis are actually not going to be noticeable until it's further progressed. So by the time you start experiencing symptoms, sometimes it's actually progressed pretty far. So it's good to get on top of it before you even notice any signs and symptoms. But some of the symptoms could be a loss in height. It could be noticing some changes in your posture, maybe some more curvature of your spine, maybe having some back pain. Some of those can be common things. So who's at risk for developing osteoporosis? Really, all of us are at risk, but women who are of either white or Asian race are at higher risk. Also those with lower reproductive hormones, so women past menopause, or men over the age of 70 are at increased risk. Also, those who have lower physical activity levels are at much greater risk. Anyone who maybe doesn't get enough calcium in their diet, or maybe has digestive issues that causes them to have poor absorption of nutrients is at risk. Anyone who's been on corticosteroids or medications such as those may be at greater risk. Also, alcohol and tobacco use increase your risk of osteoporosis. So what can we do to decrease your risk? Unfortunately, genetics are your genetics, so we can't do anything to change those. But there are lots of other factors that we do have control over. Because hormones are such an important piece of our bone mass, it may be a good idea to talk to your doctor and see if hormone replacement therapy would be a good option for you. It's also important to work with your doctor to check other hormone levels, such as your thyroid, to make sure that it's where it should be, because that could also be affecting bone mass. Definitely including daily exercise, especially weight-bearing exercise, is very important for building bone mass. Making sure that your diet includes foods that are rich in calcium. So examples of that would be your dairy products, green leafy vegetables, foods that are fortified with calcium, and some soy products are good sources of the calcium. Also, making sure that you're getting enough vitamin D, because that's going to help absorb the calcium. So we do get our vitamin D from sunlight, but if maybe you have limited exposure to sunlight, talk to your doctor, see if maybe you need some supplementation of either calcium or vitamin D. And then the other thing that we can control is trying to either stop or minimize the use of alcohol and tobacco products.